This is a relay project.
Real Talk starts right now. Here's Ryan Jasperson.
I guess you could call this an episode all about follow-up. In just a second, we're going to talk to Jasper's mayor, Richard Ireland. I'm going to go ahead and stick my neck out there and say there's nobody on planet Earth that cares more about Jasper than Richard Ireland. And I recognize that's not my place to say, and I recognize I might get some emails from people that could argue their own compelling case that they indeed are the person on planet Earth that most loves the township of Jasper National Park. But you're about to hear from a passionate mayor. You're about to hear from a mayor whose efforts and whose composure and whose leadership through the past 5-6 weeks have really been nothing short of remarkable, especially considering the loss that his community has sustained, the loss that he and his family have sustained as well. We're going to get an update on Jasper's rebuild as more and more residents are able to return home, and of course, as many more as well are far, far away from that reality. We're also going to talk to the president of the Alberta Medical Association. Every time that Dr. Paul Parks is on the show, we get a candid individual who has experience. He's currently still working as an ER doc in southern Alberta. And of course, he's also doing a lot of the work of the association, talking to politicians, talking to stakeholders, working on policy. One of the biggest stories politically in Canada this week has been Alberta Premier Danielle Smith's threat, essentially, to strip hospitals, facilities, and services away from Alberta Health Services to be administered by other governing bodies like Covenant Health. And it's got a lot of people talking about the implications of that and also what's prompted it. The Premier invoking some interesting words, talking about competition, which some people may say, well, yeah, makes perfect sense. You want to bring the most out of people. Let's talk about introducing a healthy competition. The Premier also invoked the word fear. And I'm going to ask Dr. Parks how he feels about that. Plus, we'll take a look back at our interview yesterday with the two lawyers that have launched a class action suit against the provincial and federal governments, the Alberta government and Ottawa, for their role in what these lawyers are describing as a cover-up, as deliberate dishonesty in promoting the COVID-19 vaccine. Now, there were some pretty significant claims, some pretty wild claims made during that interview. If you missed it, I encourage you to check it out. It's an interesting perspective, but of course we want to also make sure that we truly understand the reality of that vaccine and the implications that it had on the Canadian population. It's no number to slough at. 11,000 people, serious vaccine-related injuries, but also 0.01% of the population. So if you look at this, if it's a member of your family that has the serious health issue, this is something that is major to you. And if you're just looking at the statistics, you go, well, yeah, this is kind of par for the course for vaccines and medicine, isn't it? So we want to continue that conversation. Mayor Ireland in 30 seconds, but first I want to let you know that this episode simply doesn't happen without the presenting sponsorship of Relo. It's Alberta's top online real estate school, and you can find them at relo.ca. That's relo.ca, the best place to start your career in real estate. There's a number of reasons why they're the top online real estate school in Alberta. They've got the professional practice network that sets them apart from everybody else in the business. The only real estate school that has that, professional development webinars and a whole lot more. They've got their Reco system community. You can learn more about what that means by checking out their website. And don't forget, if you're going to get started on the Alberta residential real estate bundle or the Alberta commercial real estate bundle, or heck, maybe you're going to do both, make sure you use the promo code Ryan100. That's all one word. It'll save $100 on each of those bundles. That's Ryan100 when you get started today at relo.ca. As we welcome His Worship, the Mayor of Jasper, Richard Ireland, to the show. This is the first opportunity that we've had a chance to connect with Mayor Ireland since his town, of course, faced a wildfire about 5 weeks ago. Mayor, it's nice to see your face. How are you holding up?
Oh, I'm reasonably well, thank you, Ryan, and I appreciate your patience. I know you sent an invitation weeks ago, and I just haven't been able to accommodate you, but I'm really happy to have this opportunity to speak with you.
Well, there's no offense taken, my man, and I know that you've had a plate that has just been heaped with tasks right now. What does the average day look like for you 5 weeks or so removed from the fire?
It all honestly feels like it's the same day, Ryan. They meld together. Numerous emails, messages, meetings, lots of Zoom calls. It has just been continuous. But if I can expand a bit, your really kind introduction. I will say that it's not a contest of who loves Jasper most. What we have found over these last 5 weeks, based on emails and text messages and voicemails from people throughout Alberta, from across Canada, and literally from around the world, is that everybody loves Jasper. And we're all engaged together to rebuild our community and get back on our feet. And we really do appreciate your support, Ryan. Thank you for that.
Well, yeah, I mean, just on a personal level, Jasper is a town that's very important to our family, and I know that I kind of speak on behalf of an audience that feels the same way, because we hear it from people all the time. I think you know about our My Jasper Memories feature that we run. We have Real Talk audience members sharing their memories with us on a weekly basis, and so I know this is a story. It's safe to say a story that's resonated with people, impacted people across the country. My understanding is that your home, your family home, was one of those that was lost in the fire. Is that indeed the case? And if so, how are you managing personally? Are you commuting into town? Are you working from afar? How are you making it all happen right now, Mayor?
Well, like I think about 820 other families and individuals, my wife and I lost our family home, and that is, of course, particularly distressing for us, and an issue that we have to confront, but we're not different than so many other residents in that regard. I have had the opportunity to get back to Jasper now. A childhood friend with a family home on the same block as my home has offered my wife and I his home for as long as we need it. So we are here, and now we're working hard to ensure that everybody else who has lost homes has an opportunity to get back to Jasper just as soon as possible.
I guess it was about a week ago that sort of officially some residents were able to return back, and I can't imagine the yeoman's work that's been done behind the scenes to ensure that the utilities are ready and that the grocery stores are ready and the gas stations and everything, the remaining gas stations, I should say. But what's the last week been like or so? Obviously, not everybody that was calling Jasper home in the middle of July has a home to return to right now. But what have you seen from the residents that have been able to come back? And maybe you might tell us about a memorable conversation or two that you've had.
Every conversation has been memorable, and there's been lots of them. But as our residents begin to re-enter the community, what I'm finding is that the spirit of the community, the attitude toward rebuilding, to reestablishing our community and our local visitor economy is just palpable. People are ready to be engaged in that. There are a few businesses that have reopened to serve residents, and they are absolutely fostering a sense of community. The Legion, for one, has become a real community center. It's just been wonderful with support there from the Red Cross. There's one coffee shop, Snow Dome, that I know has opened, and I've been there a couple of times. Again, fantastic community atmosphere. I think one of the smaller fast food outlets has reopened or is reopening today. The post office, another really central community hub, is going to open later this morning. So that sense of community is palpable, and it's growing, and that's the kind of conversations I hear on the street every day.
It's amazing to hear that. And obviously we know that, a few years from now, most people will be back on their feet. The town will be different, as is the case post-natural disasters like this. But sometimes I think it's hard to look 2 or 3 years into the future when you're in the now, right now. And I think that includes as well a lot of people like our family that would really love to get back to Jasper. Tourism's obviously been a huge contributor to the region's economy, and it's goes without saying, one of the crown jewels when it comes to tourism destinations across the country. Jasper National Park, its record and its majesty sort of speaks for itself. How are you balancing getting the town ready for residents, doing everything in kind of a measured and strategic approach, rolling that return out properly, and getting the tourism industry and those operators in Jasper kickstarted as soon as possible? Can you take us into that process?
Sure. And as you recognize, Ryan, Jasper is a tourism-based community. The visitor economy is our local economy. And so we know that as residents come back, one of the things that they will need is employment. They will need income, and that in almost all cases relies on the return of visitors. So with our industry partners, we are preparing for the opportunity to welcome visitors into the community. And as you said, Ryan, you know Jasper. Many of your visitors know Jasper. You know us to be an authentic community with really warm hospitality, and all of that will return just as soon as we can make it safe for visitors like yourself and your listeners to come back to the community.
Right now, as of today, the day we're talking, heading into the Labor Day long weekend, is the message to your fellow Canadians that don't have a Jasper home address: thanks so much, we'll see you soon, but please, not right now? Is that the message right now for people that'll be even traveling through on the highway?
The message is more positive, I think, than that, Ryan. The message is that we are preparing to welcome you just as soon as we can. If you are watching closely, on Tuesday, council met, and for example, we approved the hiring of 10 contract firefighters in our little town. We have always relied on volunteers, and they provide services on the highway dealing with accidents. And unfortunately, with the number of visitors we have, there are occasionally accidents on the highway. We can't safely welcome a return of visitors unless we have that covered. And so we need those essential workers in town to ensure that when visitors return, it is safe for them. So we've taken those steps, recognizing that that's one of the steps that will be required to reopen visitation. And we're working diligently every day to make sure that happens sooner rather than later.
Just so I understand clearly, Mayor, you're saying that the town has now brought on 10 firefighters that'll either replace or work with the existing volunteer fire department, and this is a permanent change for the town? This is a permanent investment that the town has just made?
No, these are 10 contract firefighters, and some of them may in fact be our former volunteers. But
got it.
Our local volunteer fire brigade, they were heroic. 8 of them lost their own homes.
Really?
Really. More of them, another 4 at least, I think, also lost their jobs. So these are people who otherwise would be volunteering to perform highway rescue and cleanup work, but they're simply unable. So we have on a short-term basis, a 6-month term, agreed to hire replacements so that we can ensure we have those services available to serve our visiting public just as soon as we can let them know that they are fully welcome and fully supported in their return.
Sounds like
I'm sorry, you go ahead.
Well, I was just going to say it sounds like a prudent move. And you touch on something that should be obvious, but I think it's important that we reiterate it. We say it out loud. There's people that have lost their homes. There's people that have lost their businesses. There's people that have lost both. And I to be honest with you, and I know a lot of people, I'm certainly far from alone on this, think about that every single day. And so this is why this is, there's many reasons why this is a story of great interest to us, but it's one that we'll continue to follow with keen interest. Mayor, I know you've got a full day today and you got to go. I appreciate your time. I want to ask you about one quick thing. I talked to the mayor, or rather the premier, when she was on her way out to Hinton. This was like 2-3 days after the fire. And she alluded to some concerns that Parks Canada and potentially the federal government, but I think more Parks Canada might use this as, and I hate to invoke the word opportunity, but as an opportunity to kind of decrease or shrink the footprint of the town. And maybe there's some legacy permit holders, could be some tourism operators, could find themselves in a tough spot attempting to rebuild. Is that something that's on your radar? Is that something that could be a thing? Is that something that you might be concerned about?
It's not, Ryan. I can appreciate that people have raised those concerns. I addressed that at all levels, including the CEO of Parks Canada, and including Minister Gibault when he made his visit to Jasper and to Hinton a number of weeks ago. And I have assurances that are sufficiently comforting to me that is not going to be the case. In fact, the opposite is true as we look to establish both temporary and interim housing to get our residents back in proximity to the town. Parks Canada has been entirely accommodating in talking about using land outside of our existing town footprint to house our residents while we rebuild the community. So yes, I appreciate that people have raised that concern, but I have raised it directly with Parks Canada officials and with the minister responsible for Parks Canada, and I am satisfied that that will not be the case. In fact, they have shown nothing but compassion and collaboration with our efforts to get our residents back home.
Thanks for taking the question. I'm going to guess that you've not Googled what they're saying about you on Reddit lately. Have you Googled Richard Ireland reviews on Reddit? May I read a few as we say goodbye? Sometimes I think people need their buckets filled, and we want to fill your bucket this morning. Somebody here says, got to give a tip of the cap to Jasper Mayor Ireland. The guy's come through as a fine communicator, soft-spoken, articulate, empathetic, just what's needed in a time of such turmoil for that fine community's residents. What about Sanksar, who says, a poor guy lost his own house during this tragedy, still providing strength to others. Absolutely amazing. Ambitious List says, what a class act. Best wishes to him and all Jasper residents and business owners as they begin the rebuilding process. And Just Electric Boogie suspects that Jasper residents wouldn't be willing to give you up, but if they were, they think that you should run for prime minister. So these are just a few of the comments about you, Mayor, on Reddit. Thanks for making time for us today. A huge amount of respect to you, to your town council, to your fellow community members, and we'll be thinking of you and here for you every single step of the way.
Well, thank you very much, Ryan. Looking forward to seeing you back in Jasper just as soon as possible.
Oh, buddy, I can't wait. I will see you out there. We've already got our list of what we're going to be doing first. That's Jasper's Mayor Richard Ireland joining us. If you'd like more information on what's happening in Jasper, the municipality itself has been doing a great job updating its website. That's jasper-alberta.ca. You can learn more about the Jasper wildfire. There's information there for residents and, of course, as well for would-be visitors, for people that have the intention of visiting as soon as they can. And then, of course, as well, our friends at Tourism Jasper, great resources there on their website at jasper.travel. You can let us know what you think about this. If you are a displaced Jasper resident, if something that we've talked about here has got you thinking about something specific or in particular, we always welcome your feedback to talk@ryanjesperson.com. We're going to welcome the president of the Alberta Medical Association, Paul Parks, to the show in about 2 minutes' time. I want to figure out more about how the medical community, how Alberta's doctors really feel about the plan that this provincial government's taking, aspiring to infuse a little competition into the healthcare system to improve outcomes, but is that the right play? Are they headed in the right direction? We'll go straight to the source coming up in just a quick second. First, a couple of things I want to tell you about. I don't know if you have ever been to Vine Arts. Have you, Johnny, yet been to Vine Arts on 124th Street in Edmonton?
Can't say I have yet.
Dude, I got to take you to this place. So Vine Arts is a bit of a big deal when you're looking for like fine wines, curated craft beer collections, the best selections in scotch, tequila, gin, mezcal. Our friends in Calgary have known about Vine Arts for quite some time, but in Edmonton, it was just about 1 year ago that they moved in, and we are thrilled to celebrate with them as they prepare to mark their 1 year anniversary. It's coming up, their first birthday bash at Vine Arts on September 14th from noon till 7, and it means 15% off the entire store, plus prizes, samples, and snacks. You may say, Jasper, why are you getting so excited about a wine shop? Well, let me tell you, I love how they organize it. So, Johnny, they don't have like the Italian wines all together, the Canadian wines all together, the French wines all together. They have different styles. So if you're looking for something like dry and crisp or bold and savory. They've got all the wines organized in those categories, so it makes you look like a genius. If you're headed to a dinner party, a barbecue, make sure you stop by Vine Arts. Learn more at vinearts.ca. September 14th, their 1-year anniversary at their beautiful new location on 124th Street. And look at this. I mean, there's nothing but excitement, nothing but enthusiasm, and we love to see it. Another business getting set to welcome people who are excited to see their brand new location. That's our friends at McBain Camera. They've just opened a beautiful, beautiful new flagship store at Mayfield Square. This has been a long time coming, and I know for photography enthusiasts, you're excited about this because they've really done up this new location, pulling out all the stops. There's more square footage. There's more items on the shelves. There's more expert staff there to help you out. Saturday, September 7th, McBain grand opens with a big tent event from 10 a.m. to 4 in the afternoon, an outdoor trade show featuring the photo industry's biggest heavy hitters, Manfrotto, Sigma, Low Pro, you name it, plus more than $10,000 in door prizes. That's coming up this September 7th, short time away. Grand opening of McBain Camera. Learn more at mcbaincamera.com. It's always good to see Dr. Paul Parks. It's even better when he can join us in studio. It doesn't happen every time we connect with the president of the Alberta Medical Association because he practices medicine in southern Alberta as an ER doc, but you're up here in the capital city of the province doing the other duty, the double duty as president of the AMA. Welcome back to the studio. What brings you to Edmonton this time?
Up here for meetings with the AMA and with the government. So
yeah. Can you tell us what you're meeting about?
Healthcare.
Yeah.
How's that work?
You don't say. You don't say.
Yeah.
Interesting.
I mean, most of it's around trying to push this family medicine funding that we talked about before and all the big pieces that we're kind of been working on for a while. So there's I think more people paying attention to the relationship between healthcare practitioners and the politicians, healthcare practitioners in the provincial government than usual. And that's saying something because people are always talking about healthcare and education. But the Premier announcing or essentially kind of laying down the gauntlet, saying that she's going to infuse a little more competition, maybe some fear into the healthcare system, musing about pulling hospitals and services away from the administrators at Alberta Health Services. Did you see this one coming? If not, how did it land? Oh, well, I didn't see those comments about fear and competition necessarily coming. We saw a little bit with their reorg that they're doing, that they had some ideas around, introducing more service providers and some ideas around having different people involved in the acute care org, for example. So, and we are trying to actually give them quite a bit of input directly around the reorg and what they're doing with these 4 pillars and how are they operationally going to work together, and raising concerns about that on multiple levels around what's going to happen between these, like, for example, continuing care and acute care, and how do we operationally control that. And that was in the background. But I think the Premier's comments were quite shocking to the medical profession and the healthcare workers out there for a couple of reasons. One is it's a bit shocking because she's our premier. The healthcare system is hers. They're running it. We're her team, right? And so to hear those kind of words are a little bit shocking. But I'll tell you a couple of things. One, fear. I hope that she didn't mean it in that way, and that fear is not a way to operate your healthcare system where we really have healthcare workers that are struggling, morale's really low, and instilling fear in any way is not a good idea. And I don't think that's where the Premier intended to go. On the other side, the competition piece, that's really concerning in the sense of, like, what's the plan? Is this just musing? Is this on the back of a cocktail napkin? Or is there a plan that you think that this is going to work? And then if that's the case, so what's the evidence? What's the evidence that in a single payer system where the government is the only payer, that introducing competition in multiple health authorities is a good thing? In fact, it's probably a bad thing in that it's actually the government competing against itself. So here's a really concrete example. In Alberta, in Edmonton zone, a lot of people might not know that we have 2 health services and 2 providers. We have the Covenant Health and we have Alberta Health Services. All objective measures, when you look at Calgary zone versus Edmonton zone, all of our objective measures are Edmonton zone's been doing worse on flow, on hospital capacity, on a lot of the patient-oriented metrics that are really important. Edmonton zone's doing worse. There's probably lots of complex factors going in there, but one of them that we're very aware of, it's because we have 2 health authorities. We have 2 CEOs, 2 administrators, 2 boards, 2 people. So in the hospitals, we have Royal Alex, U of A, run by AHS, Misericordia Grey Nuns, run by Covenant Health. And we have endless difficulties coordinating between those authorities already. That exists. That's already now. So what would make the Premier and the government think that adding more authorities and more competition or more bodies to coordinate is a good thing, when right now the evidence doesn't show that?
You're here speaking, just so I'm clear, like just so the audience is clear as well. You're representing doctors and medical professionals working for both AHS and Covenant Health, right?
Correct.
Like, I want to establish that you're not here sort of like to be defensive about AHS and to argue on behalf of AHS.
Oh, no. And
there are members working under both systems.
100%. And I should be really clear. Like, so criticizing maybe that there's difficulties coordinating AHS and Covenant Health as an example is not to criticize the healthcare workers working in either of those orgs. So, like, I have good friends and colleagues that work in Covenant Health facilities. I've merged colleagues that I've trained with, I know well, work in both those places.
Sure.
Same as in AHS. I'm not necessarily picking a horse in this race. I'm telling that I'm really trying clearly to tell this to the minister and the Premier and the government that the last thing you want is to disintegrate and have a whole bunch of bodies working and competing against each other, when the best example is workforce in Alberta. Do you really want Covenant Health and AHS fighting amongst themselves to get emerge docs or to get surgeons or general internal medicine doctors? No, you want them to coordinate. You want them actually to work in a way that would say, hey, this is where the need is, so we should put these resources there. That's the government's job. That's Alberta Health's job. So that's one of the things people kind of misunderstand a little bit too, is the government in Alberta Health says, here's what healthcare should do in Alberta. Here's how we're going to fund it and resource it. And then they get a health authority like AHS or Covenant Health to deliver that care. And right now, a lot of our troubles that we're having in the healthcare system are stuck at Alberta Health. Their funding models or resources or capacity that it doesn't matter who's the operator. You pick up, let's pretend that Elon Musk wants to come in here and they want to run some
I wouldn't rule it out,
I know,
dude.
man. And so they want to come and run some hospitals. They're going to have the same challenges. They got to work with government for the funding and resources and the mandate. And that's one thing that we have to make really clear. Like, now, some of the things that are really impacting delivery in our province is directly related to us talking with the government, building the relationship, and around workforce, resources, funding, capacity, all those pieces. And so, we could talk about chartered surgical facilities as an example. I
have surgeries written on my list of questions for you for sure.
You bring it in. You.
Well, no, but it's almost like, can I just say, sorry, like just behind the curtain for a second, interviews with professionals like you are great, because I kind of like need to just welcome you to the show and then you just go. I don't really have to ask many questions, because I think you have a pretty keen understanding of what people are concerned about. And also, I know that you have an innate ability to sort of dial in, and can I say to dumb down some of these issues so members of the general public can understand them. We will talk about surgeries, but let me just there's going to be the odd person that's listening to this that's not familiar, maybe even with what we're talking about. Or let me just a bit of background. So this was at a town hall event, a United Conservative Party town hall event in Drayton Valley, a little bit southwest of Edmonton. The Premier revealing the next stages of her government's restructuring of healthcare in Alberta, and I'm going to reference the good reporting of Brett McKay with Canadian Press on this one. She was talking quite candidly from the stage, talking about turning over facilities to other operators like Covenant Health, a Catholic healthcare provider. She says, quote, because if our operator, let's say AHS, talking about the local hospital there, isn't performing services we need them to, we're going to take the hospital back. And the next phase, says the Premier, is to see how many of these hospitals that Alberta Health Services currently operates that we can retake ownership over. We can't do it for all of them, she says. Goes on to talk about how the strategy, she hopes, will improve the delivery of healthcare, help eliminate service disruption by introducing incentives. Quote, when you're dealing with a monopoly and they believe they can deliver any type of care and there are no consequences, they're going to continue to deliver bad service. And competition is one option. She says that's why we're offering chartered surgical centers and why we're offering Covenant, says the Premier. But the other is the fear of having it taken away. That'll be a very powerful competitive incentive for for managers to say, oh my goodness, if we continue to deliver terrible care in Drayton Valley, then somebody else is going to be chosen for the operator. So those are the words of the Premier herself at the town hall event in Drayton Valley. What would you have said if you ran into her in the hallway right after you heard that?
Oh, I'm trying to tell her even now. I would say a couple things. One, I don't think she meant this, but one thing is we don't deliver bad service. Alberta Health Services and Common Health, we give amazing health care in this province. And I always we give second to none in the world. And I always am a little bit of this Cassandra or the sky's falling and talking about the bad parts of what's not working. Our issues around access. You having difficulty to get access into the healthcare system. When you're in there, you get amazing service. But here's the kicker. I understand the ideology around a free market and market driving competition and really kind of driving efficiencies. That works in many, many areas. But in healthcare, it doesn't. It actually, what you will drive if you are introducing profit margin and competition into healthcare, what you are going to drive is big business coming in and saying, hey, listen, we want to deliver the most efficient, easiest care for the highest cost. We want to make the most money. So what happens there is that then you'll get this skimming of the cream, or you get this where these businesses will come in and say, hey, we want to do the easy stuff. We want to do the stuff that is got the profit margins, the stuff that we can actually make, money off of, but we don't want to do, say, for example, that really difficult 8-hour cancer care of your pancreas that we've got to open everything up and spend 8 hours and you're really sick and you have to go in the ICU after that. And so these cancer surgeries, those there's no profit in that. It's really difficult to do. Nobody wants to do it. And that's where we're in this market now. If you were to try to say, hey, let's parcel off pieces of the healthcare system, you still need to maintain your hospitals to be able to do the hard stuff, the stuff that will kill you, the stuff that happens at 2 a.m. That's the stuff that our hospitals have to be able to do, regardless of who's administrating it, regardless of is it Alberta Health Services, is it Covenant Health, is it, Twitter or X? I mean, come on, but the point being is that those kind of ideology of competition and profit margins doesn't work in healthcare in the way that I think the Premier and the government would like it to. And here's where I'll say, look at the evidence, follow the evidence, look at what's happening in Alberta, show us the case, show us that even in the chartered surgical facilities now, again, it's in my mind, so I have to talk about it. So we have these facilities that are delivering amazing care. They're doing hips and knees and elbows and shoulders, and they're doing amazing surgeries that need to be done. But they're drawing from our workforce, nurses and anesthetists, anesthesiologists, that we can't staff our hospitals now because now we've inverted the curve. It's easier to get your knee done or your shoulder done, that's a scheduled surgery, than it is to get your appendix taken out. If you have appendicitis that's going to rupture and kill you at 2 a.m, in Calgary right now, you could go to the foothills and they'll say, hey, Ryan, you got an appendicitis, this could kill you. We're going to have to call an ambulance off the street to pick you up to take you to the Peter Lougheed because we don't have a surgical team in Calgary at the foothills to do your appendix.
And every minute matters, right?
Absolutely. And do some, now people ask me, do people have bad outcomes or die from it? Yes, we know that. Any delay in these things impact care, and will ultimately, we know of cases of bad outcomes where it ruptured and they're in hospital for weeks because they have a lot of sequelae and side effects from their appendix, as an example. But I'm talking holes in your bowels, but perforated bowels. If you have a tear in your bowel, that's an emergency surgery that every minute, until we clean it and repair it, could be life-threatening. We have to ship those within Calgary to another hospital. That's happening because we have this less coordinated, let me put it that way, less coordinated organization of how we're delivering surgical care in Alberta. And that's because we have hospitals and we have chartered surgical facilities trying to do pieces of the pie. And one thing that's very fair to the chartered surgical facilities, they'll be like, hey, we can't do that emergency care. That's not our mandate. Our mandate is to do this piece of the pie. Someone else has got to look for that.
For us civilians, can we just, I want to drill into chartered surgical facilities a little bit, because there are many different models that those could follow. Are we talking about private for-profit operators? Are we talking about a new structure? Take us into what that means.
So, I mean, in Alberta right now, it's kind of evolving in ways, but the key piece about all of our chartered surgical facilities in Alberta right now are publicly funded. So the government is paying for those.
So they can be
surgeries.
private operators, but they're publicly
They're
funded,
private operators,
which is not
and-
unprecedented in healthcare delivery.
It is not, and in fact, the challenge is that may be a good model. The challenge is coordinating it. If you're in an environment where you have a workforce that's really depleted, like we have lots of surgeons. So the surgeons aren't the rate limiting. It's the anesthetists, the anesthesiologists. If you don't have lots of them, and you still have to maintain your operating rooms in your hospitals at a fixed cost, you have to have them always ready to go because of the emergencies and the unpredictable stuff. And then you add in that they're competing for the same workforce. And if you think about this isn't a criticism of anyone that works in those facilities. They deliver amazing care. But if you're a nurse or an anesthetist and you can choose, do you want to work Monday to Friday from 7 to 5 in a controlled scheduled environment, or do you want to work in the hospital where it's often chaos? You have to take care of that multi-casualty trauma at 3 a.m. with really complex, sick, dying people, and you have to be on call. You're in the OR all night. You can't work the next day. Which one are you going to choose? Especially if you make more money in the chartered surgical facilities, the way our broken funding model is. Those are the discussions we're trying to have with government, saying, listen, like we need government's help to fix some of the funding models, to fix some of the coordination. We need Alberta Health. I have to stress this again, everybody I talk to in Alberta, they really don't have a great understanding of what Alberta Health Services is versus what Alberta Health does. And because of that, it really confuses, I think even our MLAs and our government sometimes, whose job it is and where the accountability lies on some of these big issues.
Yeah, like it's work with me here on this thought, because I think and I certainly, I'm not speaking on behalf of the Premier, I don't know, but I would just try to imagine myself as an elected official, and if I'm speaking candidly at an event, and then if I use the word fear, I kind of go, ugh, like assuming, you know what I mean? And I have some experience in saying some things that 5 seconds later you're like, I don't know if she would take that back or not. I think your average politician would, because when you're talking about healthcare and education, things like that, seniors services, family supports, the word fear is a tough look, especially for the leader of the government, for the Premier, right? But I'm not sure everybody would say the same thing about competition. And I know even as I bring this up, there's going to be people in the live chat. We'll get some emails from people that say there shouldn't be competition in healthcare, and this shouldn't be competition. But in so many ways, as they say that government should not be run like a business, I do believe that a lot of times government funds are going into huge organizations that do need to be run like a business. Right. And people would suggest that $25 billion-ish every single year into Alberta health service provision would indicate that there does need to be a streamlined business-centered approach to ensure that it's efficient and that, that Albertans are getting the most bang for their buck, et cetera, et cetera, et cetera, right? So, we can think of what do restaurants put up, like under new management, or we've seen like family businesses that sell to a new investor and then the business just takes off because there's somebody new behind the helm. Like, we look at this hospital in Lacrete as an example. That is one that is being transferred over to Covenant Health. Like, do you think that sometimes a fresh set of eyes, a new approach, a new governing body? Like, I'm just trying to explore this thought. Like, is it possible that with some, let's call it healthy competition in healthcare, that outcomes could be improved for the average Albertan?
Yeah, well, that's a big question. Lots of things in there. But yes, so am I saying that there should not be any competition ever in terms of trying to increase efficiencies and, case-based rates and things like, no, of course not. We should always be optimizing our system. Absolutely. So, but here's, your analogy is a great example, because you think about it, if you're under new management, well, here's the scoop. The government owns healthcare. They own the hospitals. So they're hiring the management and telling the management what to do. They're telling the management, you've got 3 waiters to work with, and you got 1 chef to work with, and you got 20 seats. That management might come back and say, hey, listen, this restaurant's awesome, but I can't do it with 1 chef. I need 2. You give me 1 chef, and 3 waiters. I need 2 waiters and 2 chefs. That is that the management's fault then? Is that on management if the case doesn't work? So that's an example. But again, can we increase efficiencies? Can we improve? Fear's not the word I think the Premier wanted to use, but I can't speak for her. I think that we should have people that really care about that they should be driven to improve the system and working. But I can tell you, I work with a lot of these colleagues in Covenant Health and in AHS. So I'm not picking a horse here. I'm just telling you that these administrators are working really hard. They're trying to operate in environments where sometimes, and to be really candid, government handcuffs them and doesn't give them the adequate capacity or the adequate team. And those are the discussions that we're trying to have here now with the government saying, listen, yes, I am one of the first ones to come out saying, as a professional, saying, hey, is there maybe $25 billion? Is that maybe enough in our system to run it right? And we're spending some of our money in the wrong spots? Absolutely. No question. I don't think anyone would argue with that. Are there ways we can optimize how we spend that money? But here's the scoop again. It's not AHS or Covenant Health that makes those decisions about that big pot. It's the owner of the restaurant. It's the government. And I just can't stress that enough in the sense of that. That's the relationship I've tried to spend in the last year in our organization in the AMA trying to recreate with the government, is saying we want to work with you. We want to collaborate. And ultimately, if someone's going to come forward with some good ideas and say, hey, here's a great idea for how to do surgical care in Alberta, or here's a great idea how to do general internal medicine coverage and workforce in Alberta, let's look at the evidence. Let's look at the plan. Let's have an actual plan. Let's not just kind of say, hey, you know what would be a good idea? We should just add some more health authorities in here and see what they can do. That's the gist of what most of the profession is kind of worried about and concerned about when they hear that kind of thing from our government, from the people that are elected, who own the healthcare system, who we're asking to work with collectively and saying, hey, you guys control the resources, the funding, and the big pieces that then handcuff the operators.
You're kind of invoking the Jim Prentice challenge. You're suggesting the Premier should look in the mirror.
Oh,
that's what you're doing right now, right?
No,
maybe
you're
kind of putting it back on ultimately on who's funding it and who's in charge, right? It's sort of like, to me, this is an interesting angle on this. I'm not calling this what you're doing deflection.
No,
but you are certainly pointing the finger back at them.
Well, and actually, to be even more clear, I'm saying to the Premier, sit down with me. Let's talk. Let AMA and government, let's have some good ideas together. Let's implement them. You right now, one of the things that's very clear with the reorganization, so this government been in over a year. They're operating our healthcare system, so they own it. It's theirs, and they're now spending a lot of energy and a lot of time on refocusing, which has some major issues, but they're spending more time now shuffling the deck chairs and refocusing what's happening in the system than they are necessarily working with active action with us to fix pieces that we need to move on.
How many more minutes do I have with you before you got to get to these meetings?
I'm good. As long as you need, you're good.
Awesome,
Let's
buddy.
go.
Well, we sure appreciate that. If you're just tuning in on a live streaming Mixler audio app, we're talking to Dr. Paul Parks, president of the Alberta Medical Association and an ER doc out of Southern Alberta. I want to just jump into the live chat, and I'm not even I'm just jumping in at this point.
Okay.
So it could be at any point, but it's like on fire right now. Obviously, everybody's sharing their own personal experiences. Cassandra says, I'm sorry, but after my experience, I don't know what she's talking about, but she says, after my experience, what happened with my roommate and I in the ER, we are no longer getting excellent health care. It doesn't even feel like it's second in the world. She says, it's terrible. The system needs to be properly staffed, properly funded in order for Albertans to receive excellent health care services in order to have that delivered. Kimberly says her mom had an angiogram and the surgeon opted to keep her mom in hospital for 3 weeks before the surgery just so she wouldn't get bumped. Kimberly says because that's so common. Lou says healthcare should never be about profit, period. An interesting point here from Ken, and this has been a recurring theme. You knew I was going to ask you about this with Covenant Health in particular. Ken says weeks ago he predicted that the Premier would give something to take back Alberta to the special interest group and the third party. He says having an operator that will withhold certain services like reproductive services is just that. I know I've seen the concern. You referenced the conversation on Twitter, which isn't always productive, but upon this announcement from the Premier, a lot of people said this could be the beginning or the next step toward limiting things like abortion access in Alberta. I'm not sure that everybody knows, but Covenant Health does not provide those services. They won't. There's stories of people being transferred out of palliative or end-of-life care that have been in Catholic-operated facilities that have elected for medical assistance in dying that have not had what I would expect to be the proper circumstance of put it this way, I don't think we should be moving people with medical transport to receive medical assistance in dying at that time in their life. And so there are concerns that an organization, that an agency, an operator that receives so many billions of dollars and so much government funding is not providing those services. Are you concerned that transitioning more services to Covenant Health could or would limit things like abortion or medical assistance in dying in Alberta?
Oh, so very, and the profession's very concerned. And actually, before I answer that, can I just, to the comments you said
Please,
for your viewers.
And there's lots more.
Oh, no, I just would say I echo and absolutely have been trying to advocate saying, yes, our system, we need some stabilization and some investment in key pieces because, yes, our emergency departments are overflowing, our hospitals are overflowing, our teams are working at crazy capacity, like some of them 150, 170% capacity. So, yes, there are major challenges in the healthcare system, and that's what we're trying to advocate, saying, hey, let's sit down with the government so we can actually do some of these stabilization plans to fix it. And I can chat more about that too, but I just wanted to recognize that and say absolutely not diminishing anybody's concerns that getting access and into the system is a major problem. To your question about different providers and limiting access, one thing I'll say, very concerned, and I'll say the government's expressed right on their website talking about refocusing. Their goal of refocusing is to ensure equitable access to all Albertans to healthcare, regardless of where they live. And one thing I can say right now is that even in Edmonton right now, with the way that we have two health authorities, we don't have equitable access where you live. You can mitigate that because in these Covenant Health authorities, as you said, in these hospitals, things like access to in vitro fertilization, things like any reproductive health issues, abortion, MAID, those things, they're not available in those facilities. And so you can mitigate it by transferring them to another facility in the same city to actually deal with it. But the issue is what happens if those providers move out into smaller towns where there's only one hospital, one spot to go get care. It will not basically allow that progression where we ensure everybody gets equitable access to the same health care. So I won't diminish that we have geographical challenges. And if you live far away, you're going to have to transfer in for specialty care and things like this. But there are concerns right now that there are some health authorities that have limited access to different types of care. And that shouldn't exist under our Canadian Health Act.
We haven't even mentioned like trying to get family doctors.
Yes.
We could go on. You and I have gone on for like a half an hour on that in past. You can always search our archives for more of our conversations with AMA President Dr. Paul Parks. We're going to pay a couple of bills here. Speaking of running like a business, and then I want to get into more. Erica has an anecdote about what her family did. Her husband, a 6-month scheduled date for a brain MRI. I want to get to that. Some more of your comments, and then I want to put this interview in front of you. Yesterday, I talked to a couple of lawyers. One of them, Jeff Rath, spearheading this class action, and he said some pretty interesting things, made some pretty big claims about the COVID vaccine. And I got you sitting right here, so it makes sense that we touch on that and get a physician's perspective on it. We want to thank those of you that are joining us on this episode of Real Talk. It's made possible by amazing partners of ours, like the team at Complete Care Restoration. A lot of them are out in Jasper right now, and they're working on getting that town rebuilt, not just restoring the properties, but rebuilding residents and business owners' peace of mind. This is a team that we're proud to work with. They built our studio, did an unbelievable job with it. We've seen them in action. We have witnessed their professionalism. Professional property restoration services ready to respond 24/7. We recommend them with 2 thumbs up without reservation. If disaster strikes, or if you're just looking to get some construction done, in particular, some of these office to condo conversions, consider Complete Care Restoration at CompleteCareRestoration.ca. Our friends at Friesen Brothers want to make life even easier for you. You know about the Friesen Brothers kitchens. You know about these grab-and-go items. Johnny and I are always talking about those ready-baked pizzas of theirs. Just phenomenal, the ready-baked pizzas. And then now on their app, they've got a new, a really, really neat opportunity, the Order Ahead app. So you can order Freezer Brothers party trays right from the app. Pick them up in Edmonton at Rabbit Hill and Glenora, in Fort Sask, Stony Plain. And there's more to come soon. You can check out more from the app at Freeson. That's FRESON.com. And at California Closets, they have established a reputation of absolute excellence. Johnny, I didn't tell you this story yet. I told you I was hosting the Tee Up for Tots tournament on Monday, a few days ago, and raised $1 million for the Stollery, by the way. No big deal. And there on one of the tee boxes, participating, volunteering his time for Beat the Pro, was Edmonton Oilers goaltender Stuart Skinner, who, by the way, has one of the purest golf swing. I think he was swinging an 8-iron. Unbelievable.
And mustache.
And like one of the best mustaches, maybe the best mower in the league. Pure swing, pure stash. So I say, Stu, first of all, obviously grab the photo, got to show the kids. And then I said, how is that California closet working out for you? Because, you saw that commercial on Sportsnet through the Stanley Cup final.
He's got all those hats he's got to hang up. Right?
And his eyes light up, and he goes, I love it. And I said, yeah, man, I thought you guys did a beautiful job with the commercial. I said, they sponsor our show. They partner with us. And he goes, man, unbelievable.
Nice.
Listen, if these closet installations are good enough for one of the top goaltenders in the National Hockey League, the pride of the Edmonton Oilers, we guarantee that you're going to love it too. It all starts with a free consultation. You can book that today at californiaclosets.ca. Alberta Medical Association President Paul Parks, our guest, and ER doc as well. Erica in our live chat watching us on YouTube this morning says, my husband had a 6-month scheduled date for a brain MRI. We were obviously concerned about some symptoms and didn't want to wait, so we decided to pay out of pocket, and we got in the next day for that MRI. Erica says it was a real eye-opener. I shared an anecdote like that about a month ago. It pissed off a lot of people, but facts are facts. This is happening. How common do you think this is?
I like that. Very common. And in fact, now you can actually even pay for surgeries if as long as you're out of province, you can go to another province and get your surgery done. And so the concern there again is so that is an issue now around the funding and how we fund those diagnostic and access. And the big concern there is I really firmly believe that Canadians should have equitable access to healthcare, irrespective of their ability to pay. And so for me, I think the solution is fix that. Fix some of the access pieces around DI, around getting into hospital, around getting surgical care. That's the coordinated, collaborative type approach that we're trying to work with the government. And unfortunately, as things get worse and things degrade and we're not making improvements on access, more and more of that kind of those stories and that kind of private pay creeps into our system more and more. And then it just truly ends up, kind of widening and stretching that divide of who can get access and who can't.
Giants for Life may have come up with a solution actually to all of this in the chat. Wonders, can we blame Trudeau for this mess, or has that already been done?
That's awesome.
Okay.
Yeah, you know what? Let's blame the feds because they're not putting strings on the funding payments to make us do it right. Yeah, let's just blame the feds.
Blame the feds. It works for everything else. Alberta Girl says rural care has. I hesitate because listen, people living in rural areas understand. Alberta Girl is I feel like an unofficial correspondent for us. We get a great rural perspective from Alberta Girl from time to time. But I also want to say, it's hard for me to read a comment like this where you say rural care sucks, because I know that there's doctors and nurses and people in rural areas that are going to maybe kind of take that a little bit personally, but I'll read the comment.
Yeah.
I don't need to protect everybody, but it says rural care has sucked for decades, so bad that we just all expect it to be bad. Says that EMS takeover, the paramedics, the takeover was only done to cover up the lack of ER spaces and doctors, and that was more than a decade ago. It's obviously unique challenges in rural areas, right?
Absolutely.
To state the obvious.
Absolutely. And in fact, one of the biggest problems, so again, you always have to distinguish, and I really do have to say, when you get the care from the teams, it's actually phenomenal. And even in rural, it's amazing the care they can provide. I shouldn't say even in rural, but in rural areas where resources are constrained and limited, they provide amazing care. It's getting the access, and that is deteriorating and getting worse, and you can't downplay it. It's a big issue, and that's exactly like, honestly, that's what a year. I mean, I'm sure people out there are getting sick of listening to me, saying we have to invest into primary care. It's the family medicine specialists and rural generalists that run the hospitals out in the rural area. And if you got a town that needs 5 and you only got 1 doc, well, they can only do so much. And that's where we're begging and pleading with the government, saying, you have to invest up front on some of these critical foundational pieces. Sure, if you want to have collaborative discussion around where can we find offsets and where can we find money in the budget that we could spend better, absolutely we can do that too, but you can't wait for that. You have to actually invest in some of the critical pieces, or there'll be nothing left to build on.
Yeah, I saw somebody, I wish I could remember who it was, but in the chat someone said that, how are you supposed to be competitive if you don't have the funds to be competitive, right? Like both of these governing bodies are operating on the same. Are there musings? I'm not trying to get you in trouble here, but I oftentimes will talk, like I remember back when David Eggen was the education minister, and I threw him a hot potato in an interview asking him about, amalgamating, Catholic and public school boards, and he just, like, his eyes were like, I don't think he was expecting the question. But if you want to talk about efficiency, if you want to talk about expenditures, there's a compelling argument that the two should be rolled into one. Are there serious or significant conversations in healthcare about that? Do you think that would ever happen?
Well, that's $1 million question.
I know it is.
So to be honest, yes, within the profession, we've scratched our head forever wondering why are there 2 CEOs, 2 administrative bodies, 2 boards in one city? And again, I just want to say, so people who have strong opinions about Catholic delivered healthcare or any religion-based healthcare, for and against. But I just want to say that when you're the government looking at trying to create a system and fund it, look at the evidence. What does the evidence show? And right now, again, please have everybody go out there and look. How does the Edmonton zone flow and access and patient-oriented metrics compared to Calgary zone for over 10 years, over 20 years? And they're demonstrably worse in the Edmonton zone on almost all the key metrics. And again, I don't want that to sound like I'm saying Edmonton sucks. I worked at the U of A for a long time. I've got good friends and colleagues. Everyone's working really hard in this zone. And there's some geographical challenges and some capacity challenges, and there's other factors. But one of the biggest, most obvious factors, there's 2 health authorities in the Edmonton zone, and there's only 1 in the Calgary zone. So it makes everybody scratch their head and say, why is that? What's going on with that? Does that work? Does that meet the needs of all the patients? And is it the most effective? And now explode that out, that our government's just created 4 organizations. So they've created 4 separate bodies with continuing care, family medicine, primary care, and mental health care and acute care. They're all going to have CEOs. They're going to all have administrative bodies. They're all going to have organizations. And that's a lot of redundancy. But then I ask everybody, who's going to do the operational control of those 4 orgs? Who's going to actually oversee that and do it? That's not in the plans right now. It's a bit of an odd topsy-turvy environment right now. And I don't think just spitballing and throwing out, an extra health provider here or there is the solution. I think it's more of a concerted, collaborative, coordinated plan. What are we doing? What's our vision? What's our workforce? Right now, what's our workforce in Alberta? How can you run a $25 billion company and not know how many employees you have, where they're working, and what jobs they're doing? Right now in Alberta, I'll tell you unequivocally, government can't answer that. They cannot tell us. They can only give us headcounts. They can say, great news, we have 500 new docs. They can't tell us where they're working, what jobs they're doing, what kind of primary care they're doing if they're family physicians. That's a bit crazy. That is something we got to fix. And I think that is a piece that we have to work collaboratively with the government, saying, hey, for a year I've been saying, let's sit down and do workforce planning, a provincial workforce. It doesn't exist. The committee hasn't stood up. It's not happening. So is Alberta Health Services looking at their workforce? Is Covenant Health looking at their workforce? Are all these little bodies throughout the healthcare system trying to look at pieces of it? Yes, absolutely. But are we doing it in a coordinated fashion? Zip. Nope, not at all.
Have you been paying any attention to the story of this class action launched by Rath and Company, this law firm, these Alberta lawyers? I wish people listening to the podcast could have seen the expression on your face there, but I'll get you to respond in just a second. It's a class action targeting the Alberta and federal governments, essentially alleging negligence. They're calling it a cover-up, saying that they had information from manufacturers like Pfizer about the COVID vaccine, yet called it safe and effective. at the behest and at the request of several, like a significant number of Real Talk audience members. We talked to these lawyers yesterday, Eva Chipiuk and Jeff Rath. They talked to us about the class action. It's our August 28th episode if you want to check it out. Really, the question is, do people who have suffered serious side effects from the vaccine, per Health Canada, there's almost 12,000 of them in the country, do they deserve compensation? And if so, who should that come from? That's kind of the premise of the question. But obviously, during the interview, Mr. Rath in particular starts arguing his case. Like, this is not the courtroom, but he starts presenting a lot of facts and a lot of numbers, making a lot of assertions. And we want to make sure that we're sort of returning back to truth all the time, that we're fact-checking things. And I was hoping to put a couple of these claims in front of you to just get your take on it. You're an ER doc. You're president of the AMA. All right. So throw those headphones on. We're going to bring you, this is just, 30, 45 seconds from our conversation one day ago, August 28th, with lawyer Jeff Rath.
The real issue is that all of these horrible side effects were well known in advance, including, an exponentially increased miscarriage rate in pregnant women. Yet we have, public health officials telling pregnant women to run out and get the shot. It's safe and effective. They don't tell these women that there's a 25% increased rate of miscarriage coming directly from Pfizer's own data. Heaven forbid that we tell anybody that there's anything harmful that arises from these shots. It was just one lie after another.
He goes on to talk about, and one particularly, one claim that really sort of raised my eyebrows. He talks how the impact of the vaccine on children. He said that children would be more likely to die from the vaccine than from COVID itself. And that one kind of stopped me in my tracks a little bit. But I wanted to get your comments on that, generally speaking, and then maybe we can dial in.
Yeah, so a couple there's a lot there. A couple big pieces. First, I want to say, the vaccines. So was the COVID vaccine perfect, and did it end the pandemic and totally end everything? No. And did some people hope that happened or maybe sold it that way? Yes, I think there was some hope that it would totally get rid of everything and be the panacea. It wasn't, but did it work? Unequivocally, there's evidence it worked very well. So and then the second piece, I can't speak to any of the legal stuff he's talking about, but the second piece I would say is that to anybody, there was clear evidence and discussion around nothing we do in medicine is without risk. Nothing. Zero. In fact, I even saw how he diminished about, you brought the example of taking a Tylenol. Well, yes, like a single dose of Tylenol can kill people. They can have an anaphylactic allergic reaction to it. People have died from a single dose of it. It's not dose dependent. Yes, if you overdose on it, lots of issues too. There's nothing we do in medicine that doesn't have some risk. So am I in favor of disclosing the risks and people being understanding of the risk? Absolutely. And I want to say, like, an antibiotic, as an example, is something people take for granted every day in our world. The risks of an antibiotic killing you is like 1 in 10,000. It can slide, and there's lots, but that's a real number, Ryan. And every day we're using them. And have I seen a young patient that took antibiotics for a sore throat and got, C. diff, so a bad infection of their bowel to where it ruptured, and they had a colostomy for the rest of their life. Ooh. Because they were using an antibiotic. Yes. Like, is that good? No. In fact, I feel for anybody out there that has bad effects or outcomes or adverse events from anything we do in medicine, and we should never denigrate that or diminish it. We should talk about it, and we should support those families when it happens and those pieces. But what I want to stress is that everything we do in medicine has a risk, everything. And you come in to see me and emerge with your heart attack, and I give you a clot buster, there's a 1 in 1,000 risk. 1 in 1,000. Of every 1,000 that we do, someone will have a massive bleed in their head. It's a bad outcome. We can't predict who's going to happen. We try to inform people so they understand it, but then we weigh the risks and benefits and say, listen, I think you're going to die of your heart attack. This clot that's in your heart is going to kill you and is way more risk than this medicine, for example. So those are real risks. And so if you put that in perspective of the COVID vaccine, yes, there are people who have had bad outcomes, and yes, there always is a risk to any treatment we do, and my heart goes out to them. And I would never, ever want to diminish the 11,000 people who have had bad outcomes. But when you put that in perspective of the billions of people who have had the COVID vaccine and the effect about how the COVID vaccine did diminish transmission, it did actually save lives in numerous ways, lots and lots of evidence around it. And even the one that, that talk about children getting it and things, one of the things that we have to put in context around vaccines too, that we're struggling with in Alberta because we really have a vaccine hesitancy that's growing and growing because of narratives against vaccines. One thing that's critical about a vaccine is it's almost as important for you as it is your loved ones around you. It actually diminishes the spread of transmissible infectious diseases to other people who have immune conditions or need to have surgery or are sick and could kill them. So there's two benefits to the vaccine. One is around what it will do to protect you. Another is what it does to protect our community. And again, we should always have discussions around, what are the risks and benefits? What are the evidence? We should for sure have informed discussions. But I just have to stress again, and I'll say it till I die, vaccines work. And even in the context of this kind of discussions that, calling it a jab and the shot and getting people, really, kind of confused about it. Now I'm seeing Albertans that are not getting vaccinated to like measles, mumps, rubella, diphtheria, all these things that are preventable, polio, like things that we've nearly prevented because of vaccines. We're seeing people die of them in Alberta now because of this hesitancy issue. So much to talk about there. I can't talk to the specifics of, he quoted so many stats in there that are so out of context that I can tell you, this is not my expertise. Look at all the infectious disease immunologists. The collective wisdom of science has shown there's no increased risks in pregnancy, as an example. Very good evidence about it. Is he maybe quoting what they looked at in extrapolating off of a study when they tried to do it and tried to think what would be the risk? And now we've done it over millions and billions of people, and lots of them pregnant, and now we have lots of data to show it's not a risk, as one example. So I don't want to debate all those stats. I just want to re-articulate that vaccines work and that everything we do in medicine has a risk, and for the people who are harmed because of those risks and benefits, absolutely we shouldn't diminish their story and their journey. It's sad. It's not what we want.
I appreciate that empathetic but evidence-based response. I find like I don't have the professional experience you do or the informed insight that you do, but like just as a layperson, that's kind of my thought on this too, is that 0.01% of every vaccine administered results in a serious negative health outcome. If you're the person who's experiencing facial paralysis or myocarditis, or at worst, a sudden and unexplained death, or at least a sudden and unanticipated death, then that 0.01% number is irrelevant because your life is forever changed. However, 0.01% is also relevant, like it or not, when you're talking about a global pandemic, when you're talking about a vaccine, or for that matter, when you're talking about any medication.
Correct.
And side effects, right? So both are true. So like as I'm listening to him yesterday and his colleague Eva Chipiuk, who joined as well, some of the stuff is like, she tells the compelling story of this gal that she's representing. This class action started with one person. Yep. And her life has been forever changed, like in a really tough way, in a really bad way.
Absolutely.
And that's a real serious situation. And so I want to hear about that. And I want to hear about these people, the people that wrote into our show and felt disrespected, denigrated. These are the words they were using, ignored. The people weren't taking their vaccine injuries or the health outcomes seriously. Yet at the same time, like some of the arguments that Mr. Rath was making yesterday, I just found to be ones that I can't get on board with. I find them to be counterproductive, or arguably dangerous if they become mainstream perspectives, mainstream arguments about how I don't believe that there was a mass cover up. I don't believe that Dr. Theresa Tam and Dr. Dina Hinshaw and the Prime Minister and Premier Jason Kenney, whose name was invoked yesterday, I don't believe that they all had information that they were hiding. And so these people's health situations are serious.
Yes.
And these people are citizens, fellow citizens. Like they deserve respect.
Absolutely.
Right? They do. And they deserve talk shows like this to talk about that. However, the interview kind of goes like off into the ditch a little bit.
Yep.
When it starts moving away from their stories and kind of the premise for the argument.
Well, and it's everything is about context too, Ryan. So I'm with you. Like in fact, that's why I enjoy coming on the show because we should be talking about these things.
Yeah.
We should be discussing this and having reasonable, rational discourse. But I want to also say it's about context. So when this one person starts, I almost use the word spout, but starts saying a lot of stats out of context, like the myocarditis stats. Yes, it's a known side effect and it's real. And if you get it, it's bad, no question. But put that in context of the myocarditis rates that you get from having COVID, which are way higher. So you actually have to look at those two things. So when scientists are looking at it, they're kind of saying, okay, listen, there's lots of bad things that happen from having COVID, including death. Have I seen real Albertans die of COVID? Yes. Do I still have scars from going through that pandemic? Every one of my colleagues do, that were on the front line and said goodbye to people that we could have saved if we weren't in a pandemic, but our resources were so stretched that we watched them say goodbye to their loved ones on iPads. Do I have scars from that? Was it a bad time for everybody? 1,000,000,000%. But you need to put that in context. There were not only people with COVID dying, but we had many people with cancers and surgeries dying because our system was so overwhelmed. We had so much impact on our society because of the pandemic that you had to weigh, is it good to the risks and benefits of trying to get everybody vaccinated, trying to diminish transmission? But I just want to put it back again. When you say stats about myocarditis from the vaccine, yes, people should have that awareness and we should know there's a risk and benefit. The flip side is the rates of getting myocarditis and actually really severe outcomes from getting COVID are proven substantially higher. So again, you need to weigh, you need to be as someone that's thinking about this and weighing the risks and benefits. It's not just, is the risk of myocarditis, no, I don't want this. Is the risk of getting COVID, dying, or myocarditis because of COVID, dying, or any of those things, plus the risk to society, the risk to healthcare, the risk to my grandmother because she has an immune condition and if I bring her COVID back, she might die. Those things. It just don't take it in one bad outcome. And I want to take back the word little. Massive outcomes for some people. Some people died from these vaccines. I don't want to ever, minimize that there's bad outcomes from some of the things we do. And we should talk about that for sure. And we should support those people. But again, it's the bigger, broader context. And this, I think, is taking it totally out of context the way it was discussed.
It kind of reminds me, this is taking me back like 30 years, literally. Just a wonderful high school friend of mine, he and his family, they were involved in a horrific car accident. As a matter of fact, one of his siblings was killed in that car accident, and they were thrown from the vehicle, and the only person that died in the accident was the only person wearing their seatbelt.
Yep.
And right, and that may happen from time to time. Where the reason I guess I want to be careful how I say this, but the reason kind of that the survivors lived was because they were not in the vehicle as it rolled and rolled and rolled. But then you look at, like, you can't take from that, you can't extrapolate from that you're better off to survive a serious car accident by not wearing your seatbelt.
It's a perfect
because
example.
The bigger statistics are so much more telling.
It's a perfect example, and it's a bang on example, Ron, because every day in traumas, most of the people I see that have bad outcomes were not wearing their seatbelt. But have I seen the odd ones that the seatbelt killed them? Absolutely. What is the reason that government has made a reasoned and really kind of rationalized, evidence-based decision to force us to wear our seatbelts? It's actually to protect all of society. And you can say, why? Well, because it costs a lot of money to take care of those people.
Brain
in the
injuries
healthcare,
are expensive.
Brain injuries, and it's a public healthcare system, and we pay for it. So we've made a rational, evidence-based decision that we're going to infringe on some people's rights in a reasonable infringement to make you wear your seatbelts because it's a privilege to be able to drive. But I want to say it's a perfect example because, yes, do I have examples of that where the seatbelts killed someone? Yes. But do I have thousands of more examples where not wearing the seatbelt killed the person? Absolutely. And if you just want to talk about that one example and that one case of a context, it sounds like nobody should be wearing their seatbelts. Nobody should be wearing their helmets.
Yeah.
Things like that, right?
Yeah. And to be clear, my buddy does not take that position, but it's just, I've always been reminded
It's
of
sad.
that story.
Yeah,
it's obviously
very
still
sad.
sad to this day. But amazing that some of them were able to walk away or at least survive that accident, not walk away.
Yeah.
Hey, so just in closing, and thank you for this extended, I just want to reiterate like how much we appreciate you and how important I think it is to have people in positions positions of leadership, especially on important files like health and education and seniors care, immigration, the economy, that can also speak candidly and talk like real people, and are driven, like I said, by empathy and evidence. So, Paul, we really appreciate your time. In closing, the day that we are recording this episode is the day that many students are going back to school, and a lot of families are getting back into their routines. And I always like to ask people on days like this, is there a significant factor, or is this day significant? Is back to school significant in the context of healthcare? Any implications of this kind of return to routine?
No, not really. I mean, it's awesome the kids are going back to school. I think it sucks they're making them go before the long weekend.
Why do they do that?
Come on. No. So, but in that context, though, the long weekend and long weekends are, Albertans like to go out and have fun and sometimes get stupid. So be careful on the long weekends. Our healthcare system's struggling, capacity's tough. So be smart out there on the long weekend. That's more healthcare related advice for sure.
I referenced that golf tournament I was hosting the other day, and twice overhead flew stars. Yeah. And twice everybody in my group made a comment on how you're always grateful when you see that red chopper. It has a very unique sound too. Yep. You're always grateful when you see the chopper, but you also know that somebody's having the worst day of their life.
Yep. Absolutely.
And so long weekends right now, we know that there will be more drunk driving. We encourage people to not do that. We know there will be more dangerous driving. We encourage people not to do that, to camp safely. I know I sound like, I'm a grandpa here or something, no. but it's like, having worked in news for a lot of years and like as a videographer and being out on those scenes and shooting those car accidents and things like that, it's almost like my assignment editor back in the day at City TV, Randy McDonald, used to say in meetings right around mid-December, he would start saying it. It sounds cynical, but he was right every year. He said, we got to keep a camera on standby. We haven't had our Christmas. We haven't had our Christmas house fire yet, right?
Absolutely.
There's one every year, and there's bound to be a big crash during the long weekend. And if that is the case, and if the STARS chopper is called in or ambulances, what's the reality for like ERs, ORs, ICUs right now? Like, I guess you have to go location to location, but generally speaking, when people say they're crammed, when people say they're at capacity, hyperbole, or is this actually the fact?
Oh, it's not hyperbole. We're struggling and we're overflowing and jammed, but the flip, and it's a good thing to end on, I want to say, we still manage to do that kind of care. We still manage to save lives every day, squeeze those people in. And again, it's a good thing to finish that, talking about the challenges in the healthcare system. I never want to actually, diminish or forget the healthcare workers that I've flown on the helicopter. I've done STARS. I know what that takes.
You worked on the chopper?
Yeah, absolutely. I worked in Edmonton. I was one of the emerge physicians that worked trauma call on STARS. I know that. Those people, they give up their long weekends. They go do crazy, amazing things to help people. And those accidents, and they get into the hospital, and we somehow still manage to work. And that's the one thing I never want to ever scare people away from accessing or getting healthcare. I do say we need to improve access, though. And so right now, one of the sad parts is you almost have to be life or limb threatening, or dying to get in quickly these days, because that's all we got capacity for. But we'll still be taking care of Albertans and doing amazing care. So
we know that. You can learn more about what Dr. Paul Parks and his team does by checking out albertadoctors.org. That's the official website of the Alberta Medical Association. Just, 2-3 days ago, you published your most recent President's Letter, so people can learn more about the canary in the coal mine. That's the general internal medicine update from our guest here on the show today. Again, want to reiterate it. I know you shuffled your morning around a little bit to be here with us, and we appreciate it. We appreciate the work that you and your colleagues do, Paul. Thanks for this.
Yeah, no, thanks. Anytime. It's important to talk about this. I think the biggest piece Albertans need to understand we need to be transparent and clear about what's going on in the system, and we need to discuss it more. So thanks.
100%. Thanks for your availability. Again, that's albertadoctors.org. We've been talking to Dr. Paul Parks. You can take off if you need. I'm still going to read an email here from Lauren. This is a really good one. I know you got meetings to get to, even though you won't tell us what they're all about. See you, Paul. This conversation in particular made possible with the support of our friends at Kubi Renewable Energy, full-service contractor for residential and commercial solar power systems. Check this out. I'm showing you on screen. KubiEnergy.ca. You click on free quote, and it's that easy. First name, last name, email address, phone number. The next thing you know, you're talking to their team about what an install could look like, time-wise, budget-wise, and otherwise. You can also check out frequently asked solar questions and answers on their site, including, why should you choose solar energy or install panels? How do they work? Can I go grid-tied or off-grid? What happens if it snows? Will I still have an electricity bill? Great resource there at kubienergy.ca. And don't forget Positive Reflections, first episode of every week. This is when we fill your bucket. Tell you a good news story, someone paying it forward, or a random act of kindness. Positive Reflections presented weekly on Real Talk by Kubi Renewable Energy. I feel like you and I haven't talked much during the show today. It's just been fast moving and a lot of ground to cover. Live chat's been hammering down.
Oh, yeah, always.
Yeah. I wanted to reference, I don't know if you saw Ron Jeremy was in our chat today. That was exciting.
Not the actual.
Well, I'm not sure. I wouldn't rule it out. I don't know. I mean,
just a big fan.
Just a really big fan. But Ron Jeremy, and I lost it here, but I noticed, thanks for the $5 on the YouTube super chat.
Yeah.
But Ron made the implication, the insinuation, said something along the lines, and I'm quoting, I'm paraphrasing, something, immigration is to blame for most of our woes. Ron went on to talk about healthcare, housing, I think the job market, general economy, and basically said, this is can be laid at the feet of Sean Fraser, which I thought was an interesting play. Sean Fraser, the federal housing minister. There are obviously implications of immigration on things like housing and the job market. I wanted to mention two things. Number one, on August 2nd, check this out. We talked to the Minister of Immigration, Refugees, and Citizenship. That's Mark Miller, who joined us in studio on the show. Yeah, we asked him, is Canada welcoming too many immigrants? And we talked to him at length on that. You can either check out the full episode, that was August 2nd, or you can check out this highlight I'm showing you right here. I love when we put the highlights out there. It's a chance to sort of take the best, like 2 or 3 or 4 minutes of an interview. A lot of times easier to share. We ask him the question directly. So, and we also ask him if he thinks that immigration will be the election issue next fall, or at least an election issue. He kind of dodged the question, to be honest, and then was subsequently just piled on by the strategists.
Yeah.
who joined.
They were like a pack of wild dogs.
They were
them apart.
I think that I'm after following Nature is Metal on Instagram. They were like a pack of wild dogs on him. One of the
more, I was like, ugh. One of the more rabid times they were like, but I agreed with some of what they were saying. And it's always nice to have a contrast right after a guest.
Right? I think it's great because he's and my only thing was like, he's like still in the green room. He's like hearing himself just be sort of like spit roasted. But he so basically I say, is immigration going to be an election issue? Then he goes like, I don't know, if I knew what the election issue was right now, you think I'd even tell you? Kind of joked about it. And then the premise of their criticism was like, if you're a senior cabinet minister and you don't know what the election issue is outside, then that's kind of on you. Anyway, check out the full episode, but I do want to make one more point, just in relation to what Ron Jeremy said in their super chat. I just don't get to say that a lot, so I want to say it one more time. In the super chat contribution, and that was an interesting conversation I had with an individual. I know I'm talking a lot about this golf tournament. I mean, the fact of the matter is just you have interesting conversations at a place like that. And I talked to the CEO. He's a big plastics manufacturer, and they've just opened a big manufacturing plant right by the Edmonton airport. They're employing about 80 people right now, and they're in the business of like compostable bags and stuff like that. A real shot in the arm to the economy. They've made a major, it's not my news to share, but they're in the process of making a considerable support, a commitment of support to the Stollery Children's Hospital Foundation. I'll let them make that announcement. But I asked him about immigration. I asked him about staffing. This is a company, he comes out of Montreal. It's a Quebec-based company that have just opened up in Alberta like a year and a half ago. And I said, what's it been like to staff up? Like, how has that process gone? And he said, you know what? He said, it was easier than we thought it would be. I said, why? He said, because of how Alberta's handling immigration. He says, Alberta's bringing in new Canadians. Alberta's welcoming immigrants to help bolster its workforce. And he said that's gone a long way in helping us be able to staff up, because they need obviously people that are sort of like working on the assembly lines, and then they need sort of more skilled workers as well. I always feel weird putting it like that, but that's how we phrase it. And I thought that was an interesting comment. So to relate to what Ron said, I know that there are some strains obviously on housing, and immigration is a part of that. Like, there's no doubt about that. Anybody who denies that is probably ignoring the facts. But immigration is also bailing out a lot of Canadian companies, and probably writ large the Canadian economy, especially if our birth rate doesn't keep up.
And it's making cities better. You just brought up the strategist. Steven said on that episode how much Calgary has improved since they brought in immigrated workers to bolster everything about the infrastructure, everything. Calgary's an amazing city. I know people from Edmonton hate when we say that. But then another point about you saying, population versus healthcare. Like if we bring in too many people, the healthcare starts sucking. Well, it's up to the people that run the healthcare system. I look at places like China. You'd think China, an overpopulated country like that, would have horrible healthcare. They have some of the best, I don't want to say best, but for the amount of population they have really good healthcare. So I don't know if that matters. And my thing is, right now, I don't think you fix housing or healthcare without bringing in more people from other countries who are educated, who want to get further education here, and who want to bolster whatever it is, the housing market, the healthcare system, whatever it is. We need more people to do that. I just don't see us building 1 million homes without more hands.
Yeah, no, you're right. And we got to find more ways to get more Canadian high school students into university. We got to find more ways to get more local kids into medical schools.
Young kids, they all want to make apps, Ryan. They all want to be Elon Musk.
They all want to have podcasts, just like us and the strategists. So again, I know we're talking a lot about that August 2nd episode.
Great episode.
I'm showing you right now here, but I really, really enjoyed it. And you know who we haven't even mentioned? We haven't even mentioned featured on that episode, royalty joining us in studio off the top. Miss Universe Canada.
That's
Ashley Callingbull. Too, so what a show that was.
She had
on
the
August
crown
2nd.
in-house.
Yeah, she did. I know. Well, she offered us. She said we could try it on, but I think you and I felt like that was kind of like drinking from the Stanley Cup.
Yeah.
Like if you haven't earned the Miss Universe Canada crown, I don't think you should be wearing it. Mm-hmm. Would you agree?
Of course. And one thing about Paul Parks, I like how he stayed away. I mean, that clip we played, behind the curtain, there was another half of that clip I forgot to render, but he addressed all those points, but he stayed away from the ones where, like, A, I think he thought were just nonsense, and B, he's like, I need more context here. Like, where did you get this study? Yeah. How many people were involved? Did you extrapolate it over, to 3 decades to get the number you wanted?
When we were saying that yesterday in the interview too, I was saying it to the guests. I mean, they're throwing a lot at us,
mm-hmm.
and you just sort of say, listen, some of this stuff will be litigated in court. Nobody
that's
on the fly can sort of do the deep dive into the stats that are being presented. But I do think, generally speaking, thematically, we wanted to have a response to that interview, and I'm grateful that Paul took it on. Johnny, you and I put the invitation out every single day for feedback to talk@ryanjesperson.com, or you can leave comments on our TikTok, on our Instagram, on our Twitter @RealTalkRJ. There's lots of places to find us. If you ask for it personally, if you'd like John's personal cell phone number so you can give him a call and hash things out,
what?
You just let me know. But we did get this email.
It's bad enough the guests have it.
From Lorne. Yeah, we should talk about that. You need to give you a separate work phone. Lorne wrote in about the Alberta healthcare system. This was just a couple of days ago, and I appreciated his take. He said, I was just inspired to write, as everybody's aware. He says healthcare in Alberta is in crisis. Lorne says, I'm a father of 2, 47 years of age. Buddy, we're walking in the same shoes. 47, father of 2. But listen to this. Lorne says, I became disabled in April of 23 by a yet to be diagnosed neurological condition. He says, so I, like many, am standing in line waiting for services. Says, I'm terrified for my family. And he says, I'll spare you the details of my story because it might sound just like any other email that you might receive, but there has been frustration and disappointment around every corner. The reason I'm writing into Real Talk is I've seen some of these excellent interviews that you guys have done with government officials, with representatives in healthcare. And maybe my expectations of these folks are unrealistic, but what I never seem to see is any real recognition of like maybe how their community or how their group is contributing to the problem. Like they all seem to know what the solution is, and it usually involves somebody else doing something differently. The way I see it, says Lorne, everybody's responsible. The government, both current and past, regardless of party, regardless of name, the Alberta Health Services bureaucracy, the doctors and nurses who, like everybody else, always want more, the taxpayers who don't seem to want to pay for the system we claim to want and deserve. He says every group circles its wagons to protect its ideology, its mandate, and in the meantime, the system circles the drain. It's become very clear if we're going to have any chance of solving this problem, everybody's going to have to try to find a way to bend a little, says Lorne. The UCP is going to have to inject some serious money. Alberta Health Services is going to have to find efficiencies that conservatives whine about. And Lorne says, and I'm a conservative. He says the Alberta Medical Association is going to have to stop pretending that some of their people haven't figured out how to game the system to maximize their gain. And finally, taxpayers are going to have to find a way around their dogmatic aversion to paying for what we want. Talented and hardworking as they are, not all doctors and nurses are saints. There's a market for them. The ones that are already money motivated, well, they have options. And we're going to have to pay up. And I hate taxes too, but I hate being sick without help even more. He says on social media, everybody seems to know exactly who's responsible for every mess. And as a patient, I'm telling you, it's all of us. Lorne says we are all responsible. And the solution to the problem is going to have everybody doing something that doesn't fit their ideology. He says Real Talk's a trusted voice in the community. Please challenge everybody involved to step out of their individual groups into the bigger group, the bigger community, Alberta. And they'll probably all claim that they are. But we all know how it really works. We need to find a way to pick from a menu of good ideas and take actions that produce results, regardless of whose idea it is. That from Lorne, an amazing email to talk@ryanjesperson.com, and we thank you for that. We welcome your feedback, too, and want to put on your radar as we wrap this episode. And thank you for liking it and sharing it and subscribing on the podcast and on YouTube. That coming up on our next episode of the show, I'm talking August 30th. We're going to talk to 3 innovators in studio. We've been waiting for this roundtable all summer. It's the future of food. The innovation. I'm not talking recipes. I'm not talking chefs. I'm talking scientists. I'm talking people that think in a realm that plebs like me can only dream of, can only imagine. And they're going to paint a picture for us of what the future of food will look like and what it means for you. And we hope you'll join us. Talk soon.
Real Talk is hosted by Ryan Jesperson. Executive producer Josh Dunn.